At your first visit to Balance-Rite Osteopathy Clinic, we allow up to 1 hour to provide both a full assessment of your current symptom, with your first treatment carried out on the same day. Our approach to assessment is very extensive, and your body framework will be assessed in a global manner first, before zoning in on the actual area causing your symptoms. The human framework is a complicated series of bones, joints, soft tissues and levers, and the causative factors of your symptoms can be caused by an area of the body some distance away from where you are feeling your pain. So it is important that your whole framework is checked. It is necessary to undress to your undergarments in order to assess your whole mechanical framework, and you will be asked to carry out some simple bending movements of your back. So please wear something that you will be comfortable to do this in. Our macro-structural examination reveals how the musculoskeletal framework of your body functions as a whole unit, and any gross shifts and twists of your body parts can be seen. This patient attended our clinic complaining of low back pain, and by assessing her whole framework, you can see in this photograph how the patient's shoulders are shifted towards the left, and that this carries on down into the middle of her back, where the muscles on the right side are pulling her pelvis over towards the right. Here you can compare how this patient looked before treatment and how, after a course of classical osteopathic treatment at our clinic, her pelvis is now central and able to support her whole spine, with the attaching muscles and soft tissues now balanced on both sides of her spine. Her shoulder girdle now sits squarely and symmetrically at the top of her spine. With your consent, a photograph may be taken to allow you to see any evident gross twists that may be causing your problem. Patients can be quite shocked to see how twisted or asymmetrical they actually are. This patient presented complaining of neck pain and had in fact already completed a course of treatment at an osteopathic clinic in Weybridge 3 weeks earlier, where they worked only locally in the area of the neck, massaging and then manipulating it. Although this gave her some relief at the time, 3 weeks later the pain had come back and she actually felt much worse. Macro-structural examination revealed that her pelvis was side-shifted and rotated towards the left side, with more space noticeable between the elbow and pelvis on the right side. The twist through her pelvis continues down into her legs, where you can see how her left knee is extended and held behind her right knee. By continuing assessment down to her feet, you can noticeably see how her left foot turns outwards to the left, and you cannot see the big toe of this foot, with both of her heels held quite closely together at the back. After only her first treatment, you can see how the feet are placed differently, both facing forward, and you can now see the big toe of her left foot. At her knees, you can see how the left knee no longer sits behind the right. And as we move up, you can see how the left elbow is now held differently, with equal space between the arms and pelvis, and her pelvis now sits more squarely and central, providing a more solid base for her spine to sit on. This allows the mid and upper spine to sit straighter, and the attaching soft tissues and muscles are now able to be more relaxed, the left shoulder blade now not as prominent. The assessment of this patient is a very good example of why it is important to assess the whole mechanical structure of a patient and not just the local area of their painful symptoms. The first image shows how many of the causative factors contributing to her neck pain had not been addressed by her previous osteopath, and that by treating only the area in which the patient feels pain may result in a return of her symptoms, which actually may become much worse, as was the case in this patient. After assessing the whole framework, we then go on to the microstructural examination, which reveals how the vertebral bones of the spine can become twisted out of alignment in some or many areas of the spine. You can see here how the vertebral segments which make up the spine should sit in a straight line. As we follow this red line up, you can see in this case where two of the vertebrae have rotated away from the central red line, as indicated by the black arrows. In some cases, small groups of vertebrae rotate away from the central line of the spine and form a small lateral curve, as can be seen here between the two black arrows on the right. In this photo, you can see how a perfectly aligned spine should look, with the vertebrae stacked one on top of the other from top to bottom. This is what we aim for in treatment at Balance-Rite Osteopathy Clinic, so that the attaching soft tissues and muscles either side of the spine are both balanced and symmetrical, and therefore able to function mechanically in their movements at their optimum. For further details of our approach to assessment, visit our website at www.balance-rite.co.uk.